Hello everyone, welcome to Talking with Dr. Laz, your favorite health program on television, reaching you from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. On the program today, we'll be having conversation on a very important topic and a health condition that is very common in Nigeria, Africa, and in fact, everywhere in the world. Is peptic ulcer disease. It's one of those health conditions that everybody tends to act as if they know so much about it, that everybody begins to provide medical advice and begin to make recommendations on what to do and not what to do. And it's also a health condition that might appear, as not serious, but could become severe and could even lead to surgical situations when complications occur. It can be easy to manage for some persons, and other persons it might be difficult and might also require lifestyle modifications. So I have a gastroenterologist joining me today. Gastroenterologist is simply an internal physician or a specialist medical doctor who specializes in diseases affecting the gastrointestinal tract, which is from the mouth, esophagus, stomach, intestine, and all of that. So she will be providing expert opinion, and I know you can't wait to get to know more about this. But we're going to take a break, and while we do that, feel free to subscribe to our YouTube channel, Talk Health Nigeria TV, and watch as many of our previous episodes as possible. And it's all free of charge. Do stay with us. We'll be right back on this program. Welcome back to the program. This is Talking with Dr. Laz on AIT. My guest is Dr. Chikodili Umejiaku. You're welcome to the program.
Thank you very much.
Yeah, Dr. Chikodili Umejiaku is a gastroenterologist at the University of Abuja Teaching Hospital, North Central Nigeria. And she will be joining me to discuss peptic ulcer, the causes, the prevention, the management, the complications, everything you need to know. I hope to be doing this within the next 20 minutes or thereabouts. Good to have you on the program. First time having you here. Peptic ulcer, what should anyone watching this know about it?
Okay, I would like to say the first thing is that it's very common, especially in our environment. It's generally common in developing countries, but even more so in our environment. And it's something that you should have checked out, and if you have it, you should have treated, because like you rightly said, there could be many complications that come out of it. Peptic ulcer is just ulceration, a wound, and that gets to a certain layer of the lining of the stomach. So if it hasn't gotten to that layer, we won't say it's a peptic ulcer disease, but once it has gotten to that layer of any part of the gastrointestinal tract, then we'll call it a peptic ulcer disease.
Okay, so by any part of the gastrointestinal tract, does it involve the esophagus?
In some cases, yes, but that's a very rare occurrence. Commonly in the stomach and the first part of the small intestine, which we call the duodenum.
Okay. So the stomach is the gastric ulcer?
Yes.
Okay, and that's of the small intestine is the
duodenal ulcer, yes. So commonly two types, gastric ulcer in the stomach, duodenal ulcer in the first part of the small intestine.
Okay, what are those things that could lead to the ulceration of the gastrointestinal tract?
Very commonly, there's a bacteria called Helicobacter pylori that has been implicated in majority of the cases. Then other causes are things called NSAIDs. So NSAIDs are
non-steroidal
anti-inflammatory drugs. They are painkillers like ibuprofen, cataflam, feldene, alabukun, which a lot of people like to use. Those are some of the things that can cause it. Then there are other rarer causes that have been implicated. Some say like people that abuse substances, some smoking. Smoking, some people say it may not cause it, but like act together, yes, synergistically with maybe H. pylori and then worsen it, and then also prevent healing if someone has it. And things like that are what cause peptic ulcer disease.
Okay, so you mentioned, we'll go into details on some of them, but you mentioned those drugs.
Yes.
Are there precautions people should, because those drugs are important and commonly used, are there ways they could use the non-steroidal anti-inflammatory drugs that could make it not result in peptic ulcer?
Yes, usually if you're going to be on the drug for a while, or even if you're going to be on the drug and especially like a high dose, you are given a drug to like prevent, like to protect the wall of your stomach or your intestine from getting ulcerated. So there are these drugs that reduce the acidity, and they're called proton pump inhibitors, PPIs. So usually you are given those drugs, you're asked to take it maybe 30 minutes before you now take these NSAIDs, and then that way your stomach is protected. Also, most people will tell you to have eaten well before you take the drug, so that you can like provide more protection to the wall of your stomach or your intestine.
Okay, so that's perhaps one of the reasons that when you're giving some drugs, the pharmacist will tell you, make sure you eat before taking this drug.
Yes.
And some persons tend to take it for every drug. So some people will even refuse to take their drug and say, until I eat.
Oh, that's
so perhaps
wrong.
It's mainly for this.
Yes, it's usually for this kind of drugs, yes, that they'll tell you to wait, take this one, then eat, then before you take the NSAIDs like the ibuprofen and all.
Okay, what about the H. pylori? How could it be prevented? Is it a bacteria we pick up from the environment, like those fecal-oral transmitted bacteria, or how do we come about it, and how can people avoid it?
Okay, so H. pylori is very common, especially in Nigeria, very common in the tropics. I think almost every family would have someone. In fact, it's believed that with age, the percentage increases. So some say like from 20 years, about 20% of people have it. About 50 to 60 years, about 50 to 60% of people have it. So you see, as the longer you stay on earth, the chances that you pick up H. pylori is very high. When we look at the way people get ulcer and some things, you see like in twins, it's almost certain that if one twin has it, another twin will have it. If someone in a family has it, the other members of the family will have it. So it's thought that these things can be picked up from one person to another, and hygiene has been implicated.
Okay.
So usually they expect you to have good hand hygiene. Thankfully, due to COVID now, everybody does hand washing, hand sanitizing.
Some people have actually relaxed.
But it's still good to keep up such practices, because they kind of help. So because it can be easily transmitted, like if you have one person that has it in the family, cooks food and doesn't maintain such hygiene, the chances that they'll transmit it to others is very high.
Okay, that sounds good. So what are those symptoms people with peptic ulcer usually present? Of course, the most common is abdominal pain. So what are other symptoms that could be associated with it?
So the most common symptoms people have with peptic ulcer is abdominal pain. Is either when they are hungry, they have this intense pain, or once they have eaten, maybe about 30 minutes after eating, they now have pain. It's just depending on which of the type of the ulcers, either gastric ulcer or duodenal ulcer, you have such symptoms. Then the other thing is that one thing with the pain is that usually the pain is in the epigastric region, which is somewhere here, and then they feel it like going to their back. Yes, and so
epigastric is
so just around
the
here,
middle part,
yes,
upper middle part of the abdomen,
and then it goes to the back. Then the other things some people could have is mostly pain is the commonest symptoms that people have with H. pylori. Yes. Some others may feel nauseous, some others may tell you the pain is going other places, because you know our body is so connected that the pain in one place can radiate to another part or be referred to somewhere else, and then they feel it like that. So pain is the commonest symptoms people have.
Does it cause vomiting as well?
Not really, but some people, because people have different ways they manifest pain. People have different ways they manifest symptoms. Some tell you they are nauseous, while others tend to vomit. Some will tell you, okay, after vomiting, I feel better. While others, after vomiting, the pain worsens. Then in some few cases, they may also have some bloatedness. So they feel like there's excessive gas in their tummy. And so those are some of the symptoms people will just come down with.
And there could also be perhaps nausea,
yes,
feeling of
vomiting,
but
yes,
not really,
but they won't really vomit, yes.
Okay. What about fatty foods? Are there some of them that may have intolerance to fatty foods? It appears to have been implicated in some of the...
In a way, yes and no. So usually when you take in a fatty food, your body senses there's a lot of food, and so it has a lot of work to do to break it down.
So it's release gastric acid?
Yes, so there's release of more of the acid that causes the problem, one. Two, there are also some other conditions that are closely related to ulcer, like a reflux disease. Okay. So people tend to have, if they have that, there are more symptoms. We did, yes, esophageal reflux, so their symptoms seem to be more. And then other things like maybe carbonated drinks, drinks that have gas. Any drink you open that makes that shh
Okay.
Like so carbonated drinks tend to have it. Some people will tell you when they take things that are pepperish or spicy foods, maybe things with a lot of ginger or pepper, then they have such pain. So they can easily tell you what foods are like their triggers.
Yes.
For others, maybe things like caffeine, tea, then they'll have some symptoms too.
Okay, so talking about spicy foods, some persons allege that or assume that spicy food causes peptic ulcer. Does it?
No, it doesn't. It doesn't
cause
peptic ulcer. Yes, but when you now have ulcer, usually when you take spicy food, you feel the pain. But if you've been treated and you're totally cured of ulcer, you won't have the pain. But just imagine there's a wound inside of your tummy and you put a pepperish thing.
Pepper.
Yes, of course, you will feel some pain.
Okay, so I hope we are getting that peppery foods in itself does not cause peptic ulcer. But for those who already have ulcer, it could actually trigger the pain or make it worse. So what about alcohol consumption? Does it cause peptic ulcer, or does it aggravate the pain or trigger the ulcer?
I would say that it depends on the percentage of the alcohol per se. But in general, alcohol doesn't really cause peptic ulcer disease, but it kind of inhibits it stops your stomach from like healing. And then like if you take things like spirits, gins, things that are up to 40% of alcohol, yes, they could be implicated in injuring your stomach lining, and then from there the acidity and then the pepsin will worsen will now cause an ulcer to the person. So anything that would disturb the lining of your stomach, it gives it a higher chance of becoming ulcerated. Okay,
let's provide further explanation on that. So the dry gin, the whiskey, and various strong high percentage of alcohol, and some even get to mix some other things
a lot of combinations.
So there are chances that people who take that or even abuse that could possibly have erosion of their gastrointestinal tract, causing ulcer.
Yes, because when there's an erosion and there's no chance for healing, it will continue to get worse and worse until it becomes ulcerated.
I think this point is important because sometimes people hang out, abuse alcohol, and perhaps they go back home, have abdominal pain. From there, they vomit. Sometimes they might vomit blood.
Yes.
Sometimes they don't even if they are lucky, they could get to hospital on time and get treated. Some don't get that lucky and they even lose their lives.
Yes.
People begin to say it's taking poison and all of that. Are there chances that skunk alcohol abuse could lead to a situation like this without necessarily even taking poison?
Of course, alcohol in itself can cause a lot of damages to the stomach on its own, because the alcohol itself, it's toxic to the lining of your tummy. You understand? Then alcohol also causes liver problems. And then with liver problems, you also have vessels that can bleed on their own. Yes. So on its own, you can cause a problem. Then imagine adding that with some other maybe little ulceration that you have. And these ulcers, like you rightly said, could cause worse complications if not properly handled. Some of those complications are the bleeding. And anyone that bleeds uncontrollably, of course,
possibly lose one's life.
Yes.
We are saying this because these are things that occur commonly and people tend to give it other meanings. If you're watching this, get to know that alcohol, to some level, could be allowed, but it must not be abused. In fact, those who produce it said drink responsibly. And for anything that you get into the system, even drugs, medications that your doctor may prescribe, if you go above the prescription, taking a higher dose, it can be injurious to the body. It could be poison itself. So sometimes when people go to hang out, take strong alcoholic content, even sometimes mix it with all kinds of substances and keep putting it into their system, and when you talk to them and say something must kill a man. Well, when that kill a man comes, don't blame innocent village people, because when it gets abused, it can actually ulcerate the linings of the stomach or the intestine, especially the stomach actually. And that could lead to bleeding and can even lead to death if there is no immediate intervention to save that person. It's not always poison. It could just be abuse of alcohol. So we're going to take another break. And when we return, my guest is still here, Dr. Umejiaku. I'll be talking about the relationship between stress and ulcer. Is an area that there are a diversity of opinions, whether stress causes ulcer or whether it has whether it worsens or further predisposes someone to having symptoms of ulcer. We're also going to talk about other potential complications and management strategies. Do stay with us. We'll be right back shortly. Welcome back to Talking with Dr. Laz, your favorite health program on television. Yes, I'm with Dr. Chikodili Umejiaku, who is a consultant gastroenterologist at the University of Abuja Teaching Hospital here in Nigeria. And we've been discussing peptic ulcer disease, the prevention, signs, symptoms, management, and everything you need to know. Yes, good to be back, Dr. Umejiaku.
Nice being here.
Yes. Okay, so now talking about stress. What's the relationship between stress and ulcer? Sometimes there's a description, stress ulcer. Then some literature said, well, stress doesn't cause ulcer. But for someone who has H. pylori or who is already predisposed, then stress could just be a trigger for the ulcer to set in. What should our viewers get to know?
Okay, first of all, there is a separate entity called stress ulcer. So there are ulcers that result from stress. Okay, but then again, it's also noted that some people with H. pylori, there is a small subset, they feel that they don't respond well to stress. So they already have the Helicobacter pylori, they have stress, there's worsening of their symptoms. So those are still areas that are like being studied, but yes, there's a relationship between stress and ulcer or worsening of your ulcer symptoms.
Okay, that's fine. Let me try to describe this. For people who are engaged in stressful activities, especially those who are chief executives in various organizations having to handle a lot of stuff. Sometimes they are in meetings and do not even get to eat well. So could that be, okay, you are stressed, you are so busy, you are not even eating well, so that's hunger plus stress hormones that are being released. Could there be some
So you know, everybody has a different way they handle stress, and everybody's response to stress is different. Some cope very well with stress, some are not able to cope very well with stress. Some, when they are stressed, adopt bad lifestyle practices. So someone could go to work, hasn't eaten, probably didn't even eat the night before, be stressed at work, and then next thing has a headache, takes a painkiller on an empty stomach. So you can see where the build-up is from. Or just say, let me just take one bottle of something, it will help me. Put alcohol. Some also smoke to relieve stress. So you can see all practices that happen around stress too can worsen. And then also when you are stressed, there's an outpour of stress hormones in your body. Everything is on overdrive. And then, of course, you could worsen the ulcer, especially if you even have a background of maybe H. pylori already in the system. So one little H. pylori, you just give it room to get worse.
Okay, so that's good to know. So now looking at possible complications. So if one has peptic ulcer disease, of course the pain alone makes you uncomfortable until you do something. So, but are there other potential complications if it's not well taken care of?
Yes. You know, I said an ulcer is like there's a break in the lining of the stomach, okay? If you leave that break and it continues, it can get into a blood vessel and you bleed.
Okay.
And the bleeding could be very serious because you can bleed internally into your stomach, you can bleed out into the wall of your abdomen. Okay, and also remember that when you are bleeding, you're also pouring out acidity from your stomach, so it could affect other organs. So the
gastric acid gets into
and affect other organs. Also, it could just perforate because if it bleeds out, that means there's a hole. So it perforates out. And the way God made us, all our intestines are not, they work together, but not like there's no shortcuts. They have ways they work together. So that perforation too is a real risk. And then we should also know that if you peptic ulcer disease, you know, the ulceration can happen, there can be healing, ulceration can happen, there can be healing, ulceration can happen. And when there's an ulceration, like there's a swelling, so it could prevent contents from the stomach going out, what we call like a gastric outlet obstruction. Those people can now have vomiting.
So around that duodenum, the gastroduodenal junction. So that's healing. If it has some fibrosis and
or even just the presence of the ulcer can cause swelling, because you know wounds come with swelling, and then there'll be the flow of your stomach contents will not go into your intestine, and then there's now an outflow obstruction. And also know that H. pylori being in your system for a long time can even lead to gastric cancer. So these are the reasons why you should check yourself and get treated if it's there.
Wow, you've said a lot of things within a short while, and I believe anyone watching is would be good to envision this, because ulcer is like a wound. So
yes,
if it's not treated, it could get deeper,
yes,
affect the muscles and
yes,
blood vessels and
yes,
bleed, and can even perforate
yes,
the upper part of the intestine,
yes,
or the stomach.
Or the stomach.
Or when that happens, there will be the acute abdomen emergency.
Yes, that's a real emergency.
Everything that just needs to be done. It looks scary, but it happens, and especially for those who have ulcers and take substances that aggravate it. So it's just like a sudden onset. Everything happens within a very short while. Okay, looking at this, how best should people manage peptic ulcer? Usually people say, I have ulcer, and they just act based on a lot of hearsay. And also some persons, is it in every case of peptic ulcer that people need the triple therapy, and people just go over the counter to buy? What are the accurate steps people need to take when they suspect that they have ulcer?
Okay, if you suspect you have a condition, the best is to go and get tested for the condition, because when we just say pain going to the back, there are many other things that could cause that. So don't just assume that you have peptic ulcer and then go and look for the drug for it. Go and get tested for it.
Should they go directly to the lab, or should they see a doctor first?
I would always recommend you see a doctor first, so that your symptoms can be teased out, and then the right test will be prescribed for you to do. You understand? And then don't just rush to any lab to do the test, because first of all, something is common in our environment. People go to do a blood test for peptic ulcer disease. That's very wrong, because that blood test, even after treatment, stays positive.
Right.
That test is just like a good test for prevalence. It's not a good test to show whether you have it or whether you are cured. Okay, so that's why it's good to meet a qualified doctor and then have the right test done. There are various tests that can be done. Your stool can be tested. You could be asked to breathe into something. You could even have an endoscopy done to know whether you have the ulcer, but just get the right test done and then treatment.
Now, I wanted to ask you those right tests. You've gone ahead to mention them. So there could be stool test.
Yes.
There could be a breath test.
Yes. So the stool antigen test for H. pylori, or the urea breath test for H. pylori, or an endoscopy. Usually during an endoscopy, an ulcer can be seen. And it's also good because some ulcers, I told you, they can become cancerous. So a sample can be taken while having an endoscopy. And that sample taken too can be tested to know if the organism, the H. pylori, is there, so that you can go ahead to be treated for the ulcer.
Okay, that's fine. I think there is one symptom we missed out, the weight loss, especially those with gastric ulcer. Because they don't eat well. When they eat, the pain begins.
So they're very much afraid
over
to
time,
eat.
They lose weight, weight loss. Okay, so it's good. We've talked about the various prevention, the signs, symptoms, potential complications, even the investigation. So now, what other management strategies would you want our viewers to know? Okay,
so after testing and you have been found out that you have an ulcer, usually treatment is the next thing that goes on. Treatment there are varying types of treatment, and in our environment it's so easy to get an antibiotic
over the counter.
So yes, so a lot of antibiotics have been abused, and so these antibiotics work very well for ulcer, but with abuse they don't work for us as well. So that's also one of the reasons why you should go to a hospital to get tested. They'll give you the one that is currently working, and there are varying tests. Sometimes H. pylori is very difficult to eradicate. Yes, so sometimes they give you triple therapy. So triple therapy means 3 drugs, and even though it's 3 drugs, you're not given the 3 drugs to take at once. There's one they'll tell you take before food. There's one they'll tell you take with your meal or after your meal. So you see, it's not something you just go to a pharmacist and say, I want this, and they'll give it to you. Sometimes you're not giving the right explanation, and you'll be like, this thing is not going, or this is my own ulcer. Or someone will just tell you, I have ulcer. That's like as if I have hypertension that doesn't go. No, ulcer is curable. So there are different regimens for triple therapy. There's even what we call like quadruple therapy. There are also things like salvage therapy. There are like some drug-based therapies if you're not responding. But there's always a cure. And it's good to go and get the cure.
And what works for A might not exactly be what works for
Of course, because A might have even abused the drug before coming. So if you go and take what A took, you might not get the response. You understand?
So some drugs are usually being advertised on TV. If you have heartburn, if you have had this, take so and so drug, and you just see it work like miracle.
Okay, so those are just like relievers. They're not for cure. They're just to relieve the symptoms. We also give those drugs like when we're starting to treat. We give people and say you can take this around. When you have the pain, you can just take this, but not really for cure. They're just like antacids to like reduce the acidity
of the of those gastric acid secretions. Okay, so you've heard that those drugs have to relieve pains and grant you some comfort, while the goal for the treatment is to actually achieve cure, so that you'll be willing to enjoy anything you want to. All right, I think we've had very robust conversation, Dr. Umejiaku, on this topic, and I believe anyone that watched this today would have gotten a whole lot of information. I really want to thank you for being on this program.
You're welcome.
You know, Abuja Teaching Hospital was where I had my housemanship, so I was like,
it's a great place.
So many years ago, yeah, so I'm happy seeing you from there.
Thank you so much.
Thanks for being here. And to our viewers, I really want to thank you for watching the program today. I believe you've learned one or two things about peptic ulcer disease, things that could make it worse and things that could make it get better. One key message my guest told us today is what works for Mr. A might not work for Mrs. B. So whatever it is, see a healthcare provider, and so that your own treatment, what works for you, could be implemented, and you get better and get back to your normal life. Thank you for watching the program. My name is Dr. Lars Eze. See you same station, same time next week. Bye for now.